Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast explores the latest trends in healthcare recruitment, highlighting innovative strategies, success stories, and fresh perspectives that shape the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. This episode, Workforce Wisdom, Built to Attract, Redefining Employer Branding with Shawn Kessler. Welcome, Shawn.
Hey, thanks for having me, Christy.
Shawn leads the recruitment marketing division at Aloysius, Butler & Clark, better known as AB&C, one of the largest full-service agencies in the Mid-Atlantic and one of Adweek's 50 top shops in America. An agency that is obsessive about results and combines research, creativity, and technology to move people to action. Over his 20 years of advertising and marketing experience, Shawn has helped his clients achieve the highest levels of marketing excellence. He is a recipient of the Association of American Medical Colleges Award of Distinction and has won numerous advertising awards for his campaign work. Shawn recently released his first book, Built to Attract, which explores the transformative idea that the most effective employer brands are built through empowered employees, people who do not just work for the organization, but believe in it and advocate for it. He has also had articles published in the Reagan's Healthcare Communication News, the Journal of the Association of Staff Physician Recruiters, the New England Journal of Medicine's Recruiting Physicians Today, PracticeLink's magazine and newsletter, and Spectrum, newsletter of the Society of Healthcare Strategy and Market Development. Additionally, Shawn has been quoted in multiple health leaders' media articles and other national publications. So welcome again, Shawn. You've spent over 2 decades in advertising and marketing. What initially drew you into the world of recruitment marketing, specifically within healthcare?
So it was actually circumstance. So let me explain. Almost 25 years ago, I was working at Geisinger Health System in Danville, Pennsylvania. I was in the marketing department, working as just a marketing strategist or specialist within the system itself. And I had different service lines that I worked on, pediatrics and other different service lines that I worked on. But Dr. Steele had recently joined the organization. Dr. Steele was an absolutely brilliant leader. And Dr. Steele made the statement that he couldn't turn Geisinger into what he envisioned it being if marketing didn't support recruitment, which frankly was a very forward-thinking concept, especially that long ago. And so with that, the leadership of my department came to me and said, Dr. Steele made this a priority, and now it's your priority. So I didn't realize at the time that would be the moment in my life that kind of set me on a completely different path. But I'm really glad that it did. It's opened up so many different opportunities for me. I've gotten to work with so many great people right from the very start, getting to work with Kurt Scott when he was at Geisinger, and then continuing to work with wonderful people all throughout the industry over the last 20 years.
You mentioned, just kind of stumbling into it in a way. You at least were in the marketing department. I think for many recruiters, they say, well, how did you get into recruitment? You didn't go to recruiter school.
Right.
Yeah. You were there and had a very forward-thinking leader, it sounds like, to help you on that path.
Yeah. Dr. Steele is one of those leaders that I feel very comfortable saying he was an individual that was playing chess when all of the other leaders were trying to figure out how to play checkers. So to that end, I think he was a brilliant leader for the organization and did amazing things at Geisinger. And my career, frankly, got kicked off the way that it did because of his innovative thinking.
Yeah. No, and it's great to hear the partnership between the marketing team and the recruitment team as being a focus, because we often hear of that being an antagonistic relationship where you need a piece of collateral or you need a website or a video, and it isn't always a priority that those two departments work together.
Yeah, we see that quite often. And a lot of times AB&C, we end up being the bridge between those two departments to try to smooth that out a little bit. Because as you're saying, the marketing department typically is so focused on how do we provide for the needs of the patients and the service lines to make sure that the communities that we serve know that these certain procedures are available and things like that. They're not necessarily set up well to help support the recruitment function. So we do find ourselves in standing in that gap a lot.
So tell us a little bit. I mean, I'm sure you've seen some really significant changes over your career, and then being in-house recruitment marketing, and as you said, now, providing kind of that external support to those teams. But is there anything specific within the recruitment marketing landscape that's just been like a really wow moment for you?
So it's kind of funny because I think in recruitment marketing, I think we're in a constant state of change. And I think a lot of us in the industry, we don't look at it really from the how do I get out of this state of change as much as we seek it out. And what I mean by that is, I think we're constantly looking for what's that next thing that's going to help my client partner really kind of get better results, or help them show themselves in a more positive light to the candidates that they're trying to attract. So ultimately, I think we're always looking for that next change, that next thing that can be the next big positive. So with that, I mean, we see that work goes through cycles, right? And the question we need to be asking ourselves is always, when what works stops working, what do you do? Right? So far too often, Christy, I think we really genuinely sometimes hang on to the things that don't work well because they're safe and they're the things that we've done in the past. And frankly, they're defendable. Like, hey, this is how we've done it before. But I think if we're being truthful with ourselves, we need to start really thinking about how do we move away from the things that aren't working well into the things that could work well a little bit faster.
I think and it can be difficult when you've had at least a financial investment, or even from a human capital, you've spent time working on something, and it's okay if the results didn't turn out to be what you thought they might be.
Yeah, and I really think that we're definitely moving into some change right now that is significantly different. And what I mean by that is, I think the biggest change I've seen is the generational differences between the boomers, Gen X, millennial, and Gen Z. And we're in a bit of a unique situation right now in that we have four completely unique generations in the workforce. Two of them kind of communicate similarly on the upper end, and two of them kind of communicate similarly on the lower end, but very different perceptions in what they see as value from an employer perspective, and the value that they can potentially bring to the table for an employer. So I think that's one of the biggest challenges. And some of the things that we're seeing statistically are really kind of eye-opening as well. In doing research around my book, some of the stats that I found, I'll share with you. So, for example, right now the birth rate in the United States is down to 1.6, which a lot of people don't track birth rates. I actually do because I'm a bit of a stat geek, and yeah, it's just who I am. But the reason that's so impactful is because we need 2.1 just to maintain a stable workforce, which really means that, before long, we're going to see about one out of every four positions that's currently stable become unstable. And that's kind of a wild stat when you think about it. The other thing that we're seeing is that millennials and Gen Z don't trust advertising. HubSpot did a research study that showed that 84% of millennials and Gen Z don't trust what they read in advertisements. Yet, Kissmetrics did a research study that showed that 89% of people trust their friends and family members more than brands. And it's pretty important when you think about it, right? I mean, and I would ask you, when you go to Amazon and you're thinking about buying a product, what's the first thing you do? Do you read the description, or do you scroll down the page to see what the review is?
Right. Right.
Right. And I think we've all kind of conditioned ourselves to do that. So we have to understand that we're dealing with generations right now that don't necessarily trust what organizations are saying, but they trust what people are saying. And probably the thing that I'm seeing that is making or causing the biggest waves or changes in the industry, and it's been this way for least 5+ years is that thanks to social media, everyone now has a voice. And this, I mean, even this podcast is an example of that, right? There are more opportunities than ever for us to actually share our thoughts and opinions and ideas, and to ultimately either advocate, for or advocate against different organizations.
Yeah, and I think you see that. I mean, I've even noticed on my LinkedIn some of the healthcare systems that I follow, and it's usually about a patient billing or, patient quality care issue, and they're not shy. It's a family member was affected by, and they're putting these things out on social media. And I do watch to see, and you'll see the organization, reply and say, we would love to help you, hello, kind of a thing. But at that point, since it's already out there, is it too late, or doing that kind of sales recovery process?
I think the recovery process is incredibly important, because I think if you ignore the statement, or if you remove the statements, frankly, I think that can be more damaging than anything else that you would do. Having a dialogue, being open is probably the most important thing that you can do. If you ignore it, or if you let that comment sit out there with no response, or if you, even worse yet, remove it when you know people have seen it and you're just removing the comment, that's damaging. And you don't need that. But if social media is truly supposed to be social, then we need to be social. But in regards to the building advocacy component that I've been talking about, how much more important is it if one of your own employees steps up and say, hey, this is really unique. We don't usually see this happen with our organization. Maybe I can help you. You know, that comes across so much more powerful than even the organization itself responding.
Yeah. Many years ago, probably at least more than a decade ago, working in organizations that really took that accountability serious, even if it was a bad patient outcome, something that, from the top down, we knew it wasn't just the quality department either that focused on that, but that, it was, own it and talk about it. And while it may be uncomfortable and you may not get to the outcome, you may still get sued, right? But it makes a very big difference that you own that and have that accountability on those mistakes.
Yeah, I think there's a recognition that we need to realize that we're human, and that, mistakes will happen. But I think when you try to hide from it, or if you try to deny it, I think it makes it so much worse.
Yeah. So you mentioned some of the stats thing, and I am probably a little weird too. I was aware of some of those birth stats, because I will often say, are there even enough people to fill all the seats we have in the workforce? And several states that I previously had hospitals in, I would watch, and where you flip, where the aging population is that much more than the birth rate. It's really kind of scary in those instances. We know physicians like to go back and typically practice, either where they were trained or where they grew up. And so that made me very scared, especially some of the states in the South where I live. That data I do think is important. And I know, for AB&C, you're really known for those obsessive results. So it's okay to focus on the data. But how do you balance kind of that creative storytelling when a lot of recruitment ends up being driven by data and these KPIs, and what have you filled and how long and how? And, tell us a little bit about that.
So it really all comes down to the one metric, I should say, that matters, right? Good hires. That's the metric that matters. We can track the clicks and the engagement and the page views and where people fall out of the hiring funnel, but the one metric that matters the most is good hires. So to that end, we found that helping organizations be able to tell great, compelling stories is the best way to attract the talent that understands what we call the give and get of an opportunity, right? This is what we are offering to you and what we want to provide you as a potential employee here. And this is the expectation that we have of what you're going to bring to the table. I think helping people understand the give and get is incredibly important, and that can be done in a bunch of different ways. It can be done through maybe a blog post that is talking about a great story of how a candidate came on board, and this is what they were hoping to do with their career, and they maybe moved to a region that maybe they weren't as excited about, but now they love it because of what they're getting to accomplish, and their family has grown to love the community. Or, frankly, even being able to talk more clearly about the pros and the cons and like what the expectation is in a job posting in a way that tells a compelling story. But ultimately, great marketing tells exactly that, a compelling story, a reason why you should want to be curious about an opportunity.
So if you're a recruiter, it feels like a soft metric to track on if the hire was a good fit. Is that something that you look at from a retention component, or do you look at patient satisfaction? What would you look at?
So, you absolutely need to look at it from a retention perspective, 100%, because I think there are far too many organizations, Christy, that one of the fallacies I talk about in my book is the say anything fallacy, which is say whatever you have to say to get the provider in the door because, we need help. But I think we all know that when you do that, ultimately what happens is they come in the door and it's ultimately destructive. You're going to get people that are not good for the organization, not good for the department. They blow up things and then they walk back out the door. And it's so we absolutely need to be looking at retention for sure. The quality metric is a much more difficult one to really wrap our brains around because a physician can be actually an outstanding provider, but their quality scores will go down if patients don't perceive that they've been able to spend enough time with them. And that's kind of one of the biggest things that people are realizing is there's a different judgment of what is quality from an organizational perspective or a patient perspective. The organization looks at it and says they have great outcomes. They're a good provider. The patient may look at it and say, they only gave me 7 minutes. They're a horrible doctor. You know, there's different metrics that we need to look at that way. But ultimately, what I mean by a good hire is that provider that comes in that's additive to the culture, that they're able to come in, they're a great team member within their organization. They're advocating for the right things. They're walking the walk. They're talking the talk. They're one of the things that I often talk about is the golden thread, and what the golden thread is how that employee ties back to the mission, vision, and values of the organization and how they can impact that. And we want to make sure that every provider is pulling on that thread in the same direction. So I think that's really the key that we need to be looking at is it's really hard to judge that if I hate to say this, if you're just like an Indeed type of job board where all they're wanting to tell you is you had this many applications. It's got to go deeper than just the number of
Mhm.
applications. It's got to be whether they were good hires.
And I think that, when you look at that for recruiters, what it means to me and to the teams that I've led, it is spending the time going through, some type of formal telephone, video interview, the site visit. You learn a lot. We can do a lot through video these days, but you learn a lot when that candidate is there, or their family that may have traveled with them, instead of just finding a warm body to fill the seat. You have to lean in quite differently. It takes more time for sure, but I think we know the value is there, and I think equally the value of filling it with the wrong person who blows up your department and leaves, that creates even more havoc, and I think it just devalues the culture you've probably built over the years in certain areas. Yeah. So what is something that a healthcare organization or recruiter could do to really differentiate themselves? We know it's a crowded market space for hiring. There are jobs everywhere for any physician or clinician, but and help them really where they have the messaging that's still authentic to the culture, because you've mentioned vision, mission, values being really, really important. How can they do that? And then I would also add, generationally, you've mentioned that things matter differently. Do you do some A/B testing? Do you put some message out to this group, that group? How do you do that?
Sure. So those are two great questions. Let me start with the first one. So the first thing that we absolutely need to be doing is we need to identify what is true. That's That's the absolute foundation essentials, right? So, what is true? What is unique about the organization and why those things matter to your different candidate personas? Okay, so we need to speak to what matters. So, for example, we everything always needs to be true. It needs to be authentic, but we know that surgeons or high-end medical specialists have different wants and needs out of their career than maybe a primary care provider. So it's incredibly important to make sure the way that AB&C approaches it is we look at a content integration strategy, which is a whole bunch of words that basically means how do we put the things that are most important and most relevant to the individual audience in front of the right audience at the right time and in the right place. So you may be speaking differently to primary care providers than you are to surgeons, but you need to speak truthfully to both. The difference is what's most important to those audiences, and also, frankly, what are going to be the things that get them to that point of wanting to make a decision, to move further down the pipeline and to investigate further. But it all starts with truth. You can't manipulate the truth. So I think that's really the key.
Yeah, and I would agree with the differentiation between the specialties on, what their focus is. Equally, if you can't guarantee blocked OR time, or, your patient volume stats are off, it won't take very long for that physician, that surgeon to come in and kind of call you on it and say, this isn't what I was told. And it definitely starts even from the very basic of the job posting, making sure that you're communicating what's clear and true about the position.
100%. The worst thing that you can do is try to bend the truth to get somebody to take the role, because it's just not going to work out in the long run.
Yeah. Even when I've had this in my career where, the whole department has walked out, or that service line, it's just imploded, and you're starting back from square one, getting the first physician in the door. Those are really tough conversations. And it takes a special person to say, yeah, I want to walk into that and I want to come in and try and fix it. I don't know that everybody is going to want that job.
You know what? At the same time, in those situations, Christy, there is that opportunity to talk about the future and what the future holds, and that this is now an opportunity that you can define. You're going to have that chance to really define what it means for that practice in the future. That you if that's the case, if you're the first one in the door, there's a bit of a responsibility there, or at least an opportunity to say you get to set the groundwork of what the perfect practice looks like.
Mm-hmm.
You can definitely turn it to be, it's not
No,
easy though.
it's not. It's not. And I think just giving the compelling amount of, the shortage of physicians, it just gets even harder when you're starting from the ground up.
Sure. But there are providers that want that. There are the providers that seek that out and look for that challenge. It's just they're harder to find.
And I think when you're recruiting to a rural market, I've had rural primary care on my book of business in the years past, but really looking at those providers who want to practice a full scope of medicine. It's very unique, and not everybody wants that, but you don't have access to dermatologists or ENT or some of these others, and you really maybe even some OB, you really get to practice at the top of your license, and that can be an attractive component if you have that in a rural setting.
I would agree completely. Yeah.
Hope you're enjoying today's podcast. Just wanted to break in here to remind you of PracticeLink's new Physician Resource Center at PracticeLink.com. To check out our Physician Resource Center, head over to PracticeLink.com today. PracticeLink's Physician Resource Center is a collected hub of content which includes valuable resources and information about contracts and compensation, the job search and interview process, quality of life and wellness, and many more areas designed specifically to inform and support physicians' professional growth and success. To check out our Physicians Resource Center, head over to PracticeLink.com today. Thank you for listening, and now we'll return to the podcast.
Are there any campaigns, over your career and some of the recognition that you've received that were particularly meaningful to you? And then what made that successful?
Yeah, over the years, I've had a ton of different campaigns that come to mind. of ones that were unique and different and kind of interesting for many different, many different reasons. I tend to fall in love with the campaigns that we've been able to do that were kind of ultra creative solutions, and it doesn't necessarily mean ultra creative from a visual perspective, but just kind of ways that we approached the campaign. And so one example of that is at one point in time we actually used weather related targeting to help a client. And so we had a client in North Carolina that they had a pediatrics group kind of basically end their contract. And it was in the middle of the winter. It was like in January. The whole group walked out, and there were a lot of openings that needed to be filled. And that's a huge challenge. A bunch of pediatricians walked out the door. We have to get the pediatricians in. What are we going to do? And the creative solution that we came up with at AB&C was a weather targeted campaign. And so let me explain what we did. So we came up with this idea that we were going to target pediatricians all across the country, but that throughout the winter, if they found themselves in an inclement weather warning, we actually would turn on our digital media campaign very heavily to those specific positions. And I think we targeted them based off of their NPI number. Basically, the advertisement said something along the lines of, want to know where the best pediatric roles are located? You're getting warmer. And it was always a photo of somebody like playing golf or something really warm. So we know they're getting ready to deal with like 12 or 14 inches of snow getting ready to hit them. And now we're in front of them with this, oh, by the way, there are these great pediatric opportunities in North Carolina. So the best part about it, though, was when they would click on the actual ad, it took them to a landing page, and the landing page would look at their IP address from where they were coming from. And it was a split screen landing page. So when they landed on the page, there was a picture of cold, miserable, God bless this photo that we had was a woman like scraping ice off of her windshield. And it had the weather report for wherever they were coming from displayed on that side. And then on the right-hand side of the screen, it had the temperatures that were currently taking place in North Carolina. And we had a picture of a woman playing golf. And so the campaign was very well received, and it actually had, great results, but it was just an ultra kind of creative way to go about, getting in front of that audience in a way that was unexpected and positive.
Yeah. Well, I know my teams over the years have used similar tactic, not as advanced as, tracking the weather and the things, but when you have locations like Marquette, Michigan, up in the UP, you get very creative. Those become summertime posts. And then, and then the reverse can be true when you have southern locations to pull people away out of those wintry places. So
Yeah, absolutely. So we've had the opportunity to do some really creative stuff over the years, and different all kinds of different campaigns. One of the things that I'm most proud of is UVA. Just after the pandemic, UVA went through an ED expansion, and it was a 7-story expansion, and they were looking for over 250 nurses and providers. And at the end of the day, we were actually able to help them bring in, I think it was almost 350 providers and nurses post COVID. And it was actually able to open some of the parts of that expansion even early. And, that was something that, we've been very proud of.
let's talk a little bit about, we talked at the beginning about sometimes that relationship between the marketing team internal to a healthcare organization and the recruitment team can not be adversarial, but you're right. The marketing team, they are focused on, growing patient procedure volumes or, growing anything. They have a very growth mindset. And so the recruitment stuff, even on a talent acquisition for nursing, can fall further back in the process. But what are some of the misconceptions within the recruiting sector and the work that we can do together or, independently within your recruitment team?
One of the biggest misconceptions that I think, and it's really a misconception is happening now and it wasn't necessarily a misconception 10 years ago, but it is a misconception that's happening now, is marketing has this feeling that they need to control everything. They like, Christy, you were in-house. You've dealt with marketing departments. You know how it was. No, we must see every single thing. We must control. We must, there will be no narrative outside of our narrative. And that's a massive mistake anymore. And the reason I say that is, we had mentioned earlier that everyone now has a voice. And to think that you can control the narrative to the level that marketing departments used to try to control the narrative 10 years ago is just, it's not possible. And so I think understanding that there's a better way to go about that is really, really important. Making sure that we understand that it's much better to build an organization in a way that you're empowering your teams to feel like they understand what makes you unique and understands what makes you valuable and what's great about being there, and then giving them the kind of the nudge to feel comfortable speaking about it is far more important. And I think what you find is when you do that, you're not getting negativity. You're getting people who are speaking to the path that they took down the road. And yeah, there are definitely guide rails that we would love for people to stay within, but you want those guide rails to be wide enough that people can explain how they got there. And there's beauty in those different paths, if I may.
And I think the more you see the teams work together, the other team I would talk about is more of that liaison, kind of that growth and outreach team, where I always thought for a really good candidate site visit, if you're involving those people who, they're marketing that new physician coming to town, but equally then you have the people who go and do the road show, that becomes a really nice, with a recruiter, a really nice, trio of folks to be able to showcase in an organization.
Absolutely. You have the individual that's there to try to make sure that they're comfortable with the community, making sure that they're comfortable getting onboarded, getting, everything that they need. But then that person coming along saying, and I'm going to be coming alongside you to make sure that we're helping build your practice and making sure that you're walking in and you can be busy as quickly as possible, meeting those goals that you want to meet. Yeah, that's a good point.
Talked a little bit about using weather to your advantage or maybe your disadvantage if you live in one of these cold climate places, but and a little bit about recruiting to rural and how you could repackage the message, right? So, what's your perspective on how rural or underserved communities could really leverage recruitment marketing to attract, and then retain, because we know those gaps in care stay open longer. So if you do land on the wrong person, it's going to be even more detrimental to the community. So what are some of the things that those in those rural markets could be doing?
It's important, and one of the biggest struggles I've seen people make over the years is they try to say the things that others are saying. They try to attract, they look at the competitors, or they look at the bigger organizations that are maybe in more urban environments, and they try to almost mimic what those organizations are doing to attract talent. And it's such a mistake, because ultimately what it really does come down to is you need to be yourself. And there is going to be, or there are going to be people who look at you and say, that's not what's for me. But chances are those would have been bad hires anyway. What you need to do is look at it more from this is who we are, this is what makes us unique, and this is what you can expect when you come here. There's value in the truth. I keep going back to the whole thing of truth, but there really is value in the truth. And, I'm actually an example of this. So I graduated from college, and I grew up in a very rural area of Pennsylvania. I graduated from college, and the first thing I said to myself was, this area is horrible. There's nothing here. I need to get out of here and go to a city. And I moved to Philadelphia. And, I worked on the campus of the University of Penn for about 4 years and worked in Philadelphia and really enjoyed my time down there. But then after a little while, my wife and I realized, you know what, we actually don't like this lifestyle, and we would prefer to be back where we were. And That's actually how I got back to Geisinger, was I actually came back to the area that I grew up in. And, you had said earlier, kind of the whole concept of BLT, right? The born, licensed, or trained. We know there's a higher propensity to bring people back into an area if they were either born, licensed, or trained there. And I'm an example of that. And sometimes it's a matter of helping to identify people who may have been born, licensed, or trained in areas similar to what you were trying to attract to. There's value in that, but truth has got to be at the very top of it.
I think one of the things you haven't mentioned yet, and we do have statistics and data, is compensation, sign-on bonus, any of those financial incentives. Where do they fit within kind of these campaign structures that you're mentioning?
Compensation is always going to be important. It's always going to be important. So one of the things that we often say is I never advocate to be the organization that pays the most. I think that's actually a mistake. And the reason I say that is because if you have people joining you simply because you pay the most, they will leave you because somebody else is willing to pay the most. So you never want that, but you need to be at least competitive compensation wise. But the core culture within your organization, the mission, the vision, the values, the way that your leadership, walks the walk and does the things that they do, the way that they model the culture within the organization, that should have value. And that value should be sufficient enough that somebody's going to be able to look at you and say, yeah, you know what, I could make a little bit more money over here, but this is the culture that I want to be part of. This is where I want to be. And I think that's really where we ultimately need to get to. Compensation, absolutely important. Don't come this don't come to me and say we can't attract primary care providers and then also let me know that you're 20% below market value of everybody else. It's never going to work. But as long as you're competitive, your culture should be a differentiator.
Sure, sure. In some of the rule settings, this can be, I think they feel like, and in many cases have often paid more, to attract some of those folks. And not saying they don't want to be there, but I understand what you're saying. It's a different mindset. We would always struggle with that on our, sourcing emails and things. That, do you put it in there? Do you leave it out? Because if you put it in there, you're attracting one kind of candidate. But it's also a transparency thing where if you're way below where that person wants to be or feels like they need to be, the value is missed on that side.
Yeah, it's hard. I tend to lean more, Christy, towards the side of transparency. And the reason I say that is ultimately they're going to get to the point where you're sharing numbers with them eventually, right? I would rather have somebody look at it and say, "Oh, that's not enough for me to go there," and not waste time, you know. But there's opportunity. I think transparency is important.
So let's talk a little bit about the future and technology and some of those trends. We've mentioned some social or at least some geo-targeting in what we've talked about, but how really is technology, AI, automation, which makes us very fast, AI, and the automation, the social targeting, how is that really changing the way recruitment marketing is approached today compared to probably even just 5 years ago? I mean, things have just changed so rapidly in the last 5 years.
Well, really, this is going to be our focus for years to come, right? I think we can all agree on that. We've historically, the way that I'm looking at it is, historically we've waited for candidates to come to us. If you think about it, you post a job, and when somebody is, they're not happy with their current role, hopefully they'll see the job that you've posted and be interested. But things are really changing because of the current, the current ways things are moving. And there's a couple of reasons for it. One, the way that we're doing it or have done it over the last 15 years is kind of miserable. Let's be honest. Like, if anybody who's looked for a job over the past 15 years and you apply for all of these jobs and half the people ghost you, or you go to an interview and people ghost you, and like it's not a great experience for candidates, and I really think what we're going to see is a golden era of how the technology is going to allow for candidates and people who are potentially interested in a role define something that they may be a really good fit for, and for recruiters at the same time, to find candidates that may not have even necessarily been actively seeking, but are just a really good option. That's happening, and or at least starting to happen, and we're starting to see a lot of that come forward. So I think that's going to be the future of where we go.
Are there any other trends or maybe a specific tool that you would identify, that folks should be paying attention to or considering adding to their toolbox?
Sure. And I think this is probably when I talk about this at conferences or when I talk about this when I'm presenting, this tends to be the thing that kind of makes people like open their eyes and get a little nervous at the same time, but it's absolutely coming. We need to be looking at and really diving in and understanding agentic AI. And really, what that's referring to is artificial intelligence systems that can perceive, reason, plan, act autonomously, and then pursue goals over time, really with minimal to no human interaction. And it's coming. And I think there's a lot of potential in agentic AI for our industry in particular. So if you think about agentic AI, let's say I'm a recruiter and I just got this brand new job requisition that I've got to try to find candidates for. Using agentic AI, I think this is probably going to happen within the next year or two. I'd be able to take that requisition, basically give it to the AI, and then tell it to review each resume that's available in a database to determine which of those resumes meet minimum requirements. But then ask the AI to review whether the physician has similar experience, has worked in similar roles in a similar location, determine if they've maybe even if they're a less experienced physician but is potentially ready to step into a more significant role. I could ask the AI then to go and sort those resumes in order of best to worst fit, or potential candidates in best to worst kind of order. And then I could ask the AI as part of that agentic AI, I could ask it to reach out to any of those providers and ask them if they would be interested in scheduling a time with a recruiter. And if they say yes, have the agentic AI review the recruiter's calendar and then reach out to the provider and say, the recruiter has times available here, here, and here. Would you like to schedule any of those times? And if they say yes, the agentic AI would schedule the meeting and then at the same time send an email to the recruiter saying, here's the resume of Dr. So-and-so. These are the top reasons why I believe they will be a great fit for this requisition. And now the AI has reviewed the rec, reviewed potential candidates, done the outreach, scheduled the interview, and given the recruiter a heads up on why it believes that candidate is potentially a good fit. And so it's scary to us because we think about those are all things that a sourcer would do for us. And it's frightening, right? That could happen. And the biggest challenge is where it may take a sourcing team several weeks to accomplish all of those things. The agentic AI could do that process and maybe send out 100 emails to ask a doctor if they're interested in a matter of minutes. It's scary, but there are going to be dramatic ways that it improves what we're able to do from an efficiency perspective.
Yeah. I think the efficiency piece is key. I think you read a lot, or I read a lot about, bots applying for jobs and like just overloading, the hiring director's mailbox. And then equally you hear about AI making the wrong assumption and then they're filtering people out that you really want in. Is there something within, if it's within the LLM or the AI that you've trained it's not doing that? Because I know, even in my career, you apply for something and if you don't have the right number of years of experience, it's, Taleo or whatever, it's automatically kicking you out, the HR software. So that's where I think, especially in the physician space and even in some of the specialized APPs where the there isn't enough quantity to go get to that point where you have a large pool of folks to choose from.
Yeah. And so I think what we're going to see, Christy, is it's not going to be great off the start, but if it's built correctly, it's going to see which of the candidates the recruiter ends up interviewing, which ones get forward through, which ones get hired, and then it starts to rank and actually learn from itself. And so, are we there yet? I don't believe we are, but boy, I'll tell you what, it's not far off.
Yeah. And I think the importance there is that it's learning from you. And so you do have to have, I use ChatGPT the most, and then I also use Grammarly, but you do have to continue to influence and train it so that it knows you, it knows your voice, it knows what you're looking for, in this case, from a hiring standpoint.
Yeah, I mean, in this situation that I'm referring to here, before you would ever want that AI to do anything like that, you should really be teaching it your brand. You should be, because, and that's this discussion. We could have a whole another podcast talking about AI and the way that it could potentially be beneficial, but the way that you also need to train it to make sure that it's very successful. But you really should make sure that it understands what your mission, vision, and values are, so that ultimately it's going to attract or identify the people that are going to be most attracted to your organization. You can't do that if you don't train it.
Yeah, I do think at some point, maybe my kids that are in high school, I'm not sure, but I feel like there will be classes on, how do you talk to your AI, the types of questions, what do you load in order to get that efficiency out on the output on the backside.
Yeah, it's amazing how many things you'll see, even now promoted on, like, for example, LinkedIn, where there are classes on how to develop better prompts, and things like that. But yeah, I mean, we're certainly in the time of a massive change coming into the industry for sure. But I think there's also a lot of value in making sure that we understand what are the best ways to use it, but to use it strategically and intelligently.
All right, let's shift gears. Let's talk about your book. So congratulations, first of all. I know Built to Attract was released within the last month or two, I think. Really what inspired you to kind of write this book, put your thoughts and words into print, and how long did it take you?
So it's funny because over the last several years, I've had several people kind of nudge me and be like, "Have you ever thought about writing a book?" And I've always kind of dismissed it. I always kind of like, "Oh, well, thanks. I appreciate the sentiment, but no, I'm not going to write a book. No." And you know, it's happened a couple of times, and that was always my answer. It was always, "No, I'm not going to write a book." But sure enough, last year, and I attended RecFest in Nashville, Tennessee. RecFest is really interesting. It's 2,500 attendees, 4 different stages, and I jokingly call it the Lollapalooza of recruitment. But I had a really great opportunity to go in and just as an attendee and sit and listen to the different sessions on the innovation stage and on the different stages. And as I was leaving, I really came to an understanding that nobody else is really talking about the things that I think are really important. And I think it's because my perspective has always been from helping organizations attract the most difficult of difficult positions into, frankly, some of the most difficult environments. We've helped groups in Anchorage, Alaska, try to bring providers in to jump on puddle jumper planes to fly in and deliver care to Inuit people of Alaska. We've done all kinds of things, right? So my career has always been focused on attracting the most difficult folks. And so I was getting on the plane in Nashville, Tennessee, and I'm like, well, maybe I should think about writing a book. And I kid you not, I opened up my laptop. By the time I landed back in Philadelphia, I had the entire outline of the book written. And, even then I said to myself, I don't know that I can write a book. I'm not sure about this. So I took about the next month, and all I did was go in and add into the outline, add in stories, add in thought, add in, more and more into it. And it got to a point where I had like a 35-page outline. At that point, I'm started thinking, maybe I can write a book." And so I started dedicating time to it, and I basically was able to finish writing it at about the first week of February. And I shared it with the partners and owners of the agency, wanting to make sure that, they had a chance to see it, that they weren't going to be like, "Oh, you're crazy, don't ever put that out there." But, I wrote it. I also had the pleasure of getting to share it with several people in our industry that I deeply respect. I had the opportunity to share it with Emerson Moses and get her to review it and think about it and give me feedback, and Alan Kikanadan at SSM Health and get his thoughts, and I had a real opportunity to share it with people throughout the industry, and the feedback was really positive. So, I continued forward, and thank God for proofreaders. Let me just throw that out there. Basically, the book released on June 3rd, and so
Okay.
far so good. It's been well received.
Good. No, I'm glad to hear that. And I do think folks that aren't in our industry and then join either through a PPR or a regional group, or just, they find themselves as a physician and provider recruiter, is very unique. So I'm not surprised that those are people that, that you reached out to and that gave you good feedback on it, because it is kind of spectacular. I don't know what recruitment is like in other segments, recruiting for retail or other things. I just think is probably a lot harder, but I do like the community feel. So I'm glad those folks were able to support you on this journey. One of the things we opened with in your bio really was the concept of empowered employees, which I love. My little two-phrase moniker has been compassionate advocate for a long time. So the word empowerment really, really speaks to me. But, with that as a central idea in your book, I think that's much more than employees referring friends, right? It really becomes that find those people that can be, or empower them to be your brand ambassadors. But elaborate on how that plays out in recruitment strategies. How, if you don't have a program like that, how could somebody get started?
Sure. So, as we had mentioned earlier in the conversation, Christy, the younger generations, they don't trust advertising, but they trust reviews, right? And so with that, we have to if we're being truthful about ourselves, that means the number one thing that somebody potentially thinking about a new opportunity is going to trust is the review of somebody who's actually already employed there. And so the more that we can do to help our employees understand the why somebody should want to be here, the better off we're going to be. With everyone now having a voice, and the most powerful, the most powerful recruitment tool on our teams is that voice. And so, yeah, we've had the concept of ambassadorship over years, but I personally believe that to a certain extent, it's worn out, because the concept of ambassadorship, I know organizations that were actually even paying people to be an ambassador, and typically speaking, marketing was telling them, these are the things that we want you to say. Here's your toolkit. We want you to say this specific thing. You're only going to respond in this specific way. We'll give you media training. We'll do these certain things. I look at it as at advocacy differently. And what I want, and for my team at AB&C, is I want my team members to advocate for me and the rest of the organization when I'm not in the room. And I think that's where we want to get to, that our employees are so empowered and passionate about where they're working and the work that they're doing and the difference that they're making and the purpose that they have in what they're doing, that when somebody is bringing up something negative, that they're willing to stand up and say, no, I work there and that's just not true. What you're saying isn't the case. Let me tell you what my experience is. That's where we start seeing that real separation. We had talked earlier about the negative comment, when you see the negative comment, but how much more empowering is it when the employee themselves is the one who makes the response? And I think that's where we need to get to. And that's the future of recruitment marketing, and the future of, frankly, talent attraction, is focusing on your culture, focusing on making the decisions that are going to strengthen your employee culture to the point where they're grateful that they're there, and that they're grateful to be part of that team, and they're excited to be part of that team, and they can't. Let me give you the best story that I can give on this. I did an interview of a CEO of a company. They're a Fortune 5 company. I did an interview. Well, they're owned by a Fortune 5 company. Let me put it that way. And I was speaking with the CEO, and they said to me, I want our employees to have so much joy working here that the joy overflows into the rest of their lives. When they're at home, the joy that they've received from being part of that organization and working there has actually overflowed into their non-work life. And I immediately sat back in my seat and I said, "Oh my God, this guy gets it." And his people, you can see it in his people. They would run through a wall for this gentleman. And that's an organization that understands what it means to have a culture that employees are excited to be part of it, and they absolutely advocate for it. That's where we're going.
Yeah. And it's very powerful. I've worked in an organization like that in the past, where the CEO's message was really, I want people to be so excited they jump out of bed in the morning, and it's not just to come to work, but it is to have that impact. When you're trying to look at that, is it something that when you go into a client and do you ask them, what is your employee engagement score on, would you recommend a friend or family member to work here? That seems to be, maybe a metric that leads you to, okay, culture's going the right way or the wrong way.
Sure. Yeah, that's one of the things that we're always asking for. So when we go into a client and we're doing an employment branding initiative where we're doing the discovery and development of an employer brand, we're always looking for that kind of information. And we also do the one-on-one interviews, because that's critically important. One of the things that we have found is that you get more out of the one-on-one interview when you can say to somebody, leadership is going to know what was said, but they'll never know who said what, so that we can really get to the truth of what are the things that are good and what are the things that are bad. And ultimately, if it's done well, and you have, I'll just say, if you have really smart leadership, they want to know the bad every bit as much as the good. And the reason I say that is, yeah, we're going to promote the good. Absolutely. We're going to talk about the good. But if you can also fix the bad, how much better does the organization become? And I think your smart leaders understand there are good, and they understand that bad actually leads to an opportunity.
Mm-hmm. I think also, really good leaders will, you have to kind of prioritize that. If there are 6 bad things, may not be able to touch all of those at once. Some of them might be a financial commitment. So, some of them just, it can be tough, right? That really understanding that and being transparent with what the initiatives are, and what you're working to, and kind of checking your way through those lists.
Yeah, 100%. There's always going to be things that are challenges, right? It's interesting. I was speaking with, well, and I actually bring this up in the book. One of the things that, I've heard over the years is, well, we can't really talk about that because we're not there yet. And I couldn't disagree more. But let me explain. You don't speak to it as though you are there. But there is so much value in saying that we recognize that that's where we want to be, and we're on our way there. And let us tell you what we're doing to try to get there, and come alongside of us and pull on that golden thread and help us get there. We're on the path. We're not there yet. Yeah, we've got some things that we've got to fix. We've got some challenges, but we're trying to fix them. There's beauty in the truth of that.
Mm-hmm. Yeah. So as we wrap up, what would be something in terms of, we've talked, about impact and things, but what would you hope for the legacy, definitely of the book, and that impact that it leaves for recruiters and marketers and healthcare leaders alike?
Really, I think the thing that I hope it helps organizations kind of lead to is to understand the importance of building great culture. That in the future, if you focus on building great culture and you focus on that engagement with your employees, in the future, that's going to be your greatest talent attraction method. That those employees are going to be the thing that stands out the most. We've all been at the holiday weekend party or something, and you can see the people that are dreading to go back to work the next day and the people that thought hasn't even crossed their mind. I've been in positions where I had the Mondays on Sunday by about 4 o'clock. You're hanging your head, you're already stressed about what you're going to walk into on Monday. But then when you meet that person that doesn't have that, and that you run into them, and it's a Monday morning, and they're excited and they're happy and they're not stressed. Wow, that's a place I want to be. And I think the more that we recognize that and understand that, the easier it becomes for us to understand just how important it is to build that culture that employees want to advocate for.
Mm-hmm. Yeah. Yeah, absolutely. And I think it's a lot with lessons where learning what you don't want, either an employer or those types of things is I think more valuable than sometimes identifying what you do want.
Yeah, absolutely. Yeah, absolutely.
Well, Shawn, I appreciate your time today. And on behalf of PracticeLink, want to extend heartfelt thank you to you for spending the time on the Workforce Wisdom podcast. I think this was an insightful conversation really about employer branding, recruitment marketing, and the inspiration behind your new book, Built to Attract. I think we touched on some different things. I think it was less marketing than some of the other pieces, more of the inspiration part.
They kind of go hand in hand if they're done right.
Absolutely. For our listeners, you can learn more about Shawn's work and connect with him, obviously, on LinkedIn, or his agency, Aloysius, Butler, and Clark, at abccreative.com. Also explore additional recruitment resources in the PracticeLink Resource Center at practicelink.com. As always, we'd love to hear your thoughts, insights, and questions about today's episodes. Feel free to reach out to us at plmedia@practicelink.com. My name is Christy Bray. Thank you for tuning in to Workforce Wisdom.